In this video, we will explore in detail three of the most devastating pandemics in the history of humanity: the Black Plague, the Spanish flu, and the COVID-19 pandemic. Each of these pandemics has left an indelible mark on history and has changed the way we live and understand public health. We will begin our historical journey with the Black Plague, a pandemic that erupted in the 14th century and ravaged Europe and Asia. We will examine its origins, how it spread, and the terrible consequences it left in its wake. Next, we will move to the 20th century to explore the Spanish flu, a pandemic that affected the entire world in 1918. We will discover how it spread rapidly, impacting populations of all ages and social strata, and how it altered the perception of global health. Finally, we will arrive at the COVID-19 pandemic, which is currently unfolding. We will analyze how it originated, its global spread, and how it has affected society, the economy, and the daily lives of people. We will also reflect on the lessons we are learning in real time as we battle this pandemic. Through this video, we will seek to understand how these pandemics have impacted humanity throughout history and how we can use that knowledge to better confront future public health challenges. Let's embark on our journey through the most devastating pandemics in history. We will begin our historical journey with the Black Plague, which occurred in the 14th century. This bubonic plague pandemic originated in Central Asia and spread through trade routes, devastating Europe and Asia. We will delve into how the Black Plague affected populations, causing a massive loss of lives and a collapse in the economy and society of the time. We will use historical images, artistic representations, and graphics to illustrate the magnitude of the Black Plague and how it changed life in the Middle Ages. We will transport ourselves to the 20th century to explore the Spanish flu pandemic, which erupted in 1918. We will discuss its origin and how it spread rapidly worldwide, even during World War I. We will analyze how this pandemic affected different population groups, from the young to the elderly, and how the lack of information and medical resources influenced its spread and mortality. We will use images and archival footage from the time to provide context and demonstrate how society faced the global health crisis at that moment. We will arrive at the COVID-19 pandemic that began in 2019. We will explain how the virus was identified, its global spread, and its impact on society, the economy, and public health. We will discuss the measures taken to control the pandemic, such as social distancing, mask wearing, and the rapid research and development of vaccines. We will show current images of the fight against COVID-19 worldwide, highlighting healthcare workers and the implementation of prevention measures. The Black Plague, one of the deadliest pandemics in history, broke out in the 14th century, specifically in the year 1347. This pandemic originated in Central Asia, where the Yersinia pestis bacterium spread through trade routes connecting Asia to Europe. As merchants and travelers carried the disease with them, it rapidly spread across entire continents. Origin and spread: the Black Plague was characterized by two main forms, bubonic plague and septicemic plague. The former was primarily transmitted through fleas on rats, while the latter was a more contagious form that spread directly between people. The spread of the plague was swift and devastating. Both urban and rural areas were affected, and entire cities were deserted due to massive mortality. As the pandemic advanced, medieval societies lacked a proper understanding of the disease or how to halt its spread. This contributed to the rapid progression of the illness. Consequences: the Black Plague had a staggering impact on the European and Asian populations. It is estimated that between 75 and 200 million people died during the pandemic. The population loss resulted in a decline in the workforce, leading to a labor shortage and significant economic changes. The Black Plague also transformed medieval society, giving rise to fear, superstition, and the persecution of Jewish communities and other minorities. Furthermore, the pandemic had a profound cultural impact, influencing the literature, art, and religion of the era. Lessons for the future: the history of the Black Plague provides us with several valuable lessons for the future. Emergency preparedness: the Black Plague underscores the importance of being prepared for public health emergencies. This includes the need for robust healthcare systems, effective contingency plans, and a rapid and coordinated response in the event of disease outbreaks. Medical research: despite the limitations of medieval medicine, The Black Plague stimulated medical research in attempts to understand and treat the disease. This highlights the ongoing importance of scientific research and the development of effective treatments in the fight against pandemics. Communication and education. During the Black Plague, the lack of understanding about the disease and its spread led to erratic and sometimes harmful responses. Effective communication and education are essential to ensure that the population understands threats and prevention measures. Solidarity and global cooperation. The Black Plague affected multiple regions and communities. Today, global cooperation is essential in addressing pandemics. The history of the Black Plague reminds us that borders are not barriers to diseases and that international solidarity is crucial. Adaptability and resilience. Societies that survived the Black Plague had to adapt and change. This demonstrates the importance of resilience and adaptability in times of crisis. Conclusion. The Black Plague is a dark chapter in human history, but it is also a powerful reminder of humanity's capacity to overcome challenges and learn from past tragedies. As we face the COVID-19 pandemic and prepare for the future, the history of the Black Plague urges us to take responsible actions, learn from history, and work together to protect public health and the well-being of humanity. Resilience and adaptability are our greatest strengths in the fight against pandemics. Let's turn our attention to the next pandemic in our historical journey, the Spanish flu of 1918. Although this outbreak originated in a very different time in history compared to the Black Plague, its impact was equally devastating in many aspects. Origin and spread. The Spanish flu, despite its name, did not originate in Spain but gained more prominence because Spain was one of the countries that openly and widely reported on the disease during World War I, contrasting with other countries that censored pandemic-related news. The pandemic spread rapidly worldwide, exacerbated by the movement of troops during the war. It is believed that the Spanish flu virus was an H1N1 influenza strain. Global impact. The Spanish flu infected about one-third of the world's population and resulted in the deaths of between 50 and 100 million people worldwide. This figure was significantly higher than the number of deaths in World War I. Unlike many pandemics that primarily affect vulnerable groups, the Spanish flu had a severe impact on young and healthy adults. This was partly because the robust immune systems of young adults often triggered an extreme immune response, causing severe lung damage. Responses and lessons. During the Spanish flu, limited access to accurate information and the lack of disease control measures led to an uneven response. Some cities and countries implemented quarantine and social distancing measures, while others did not. Despite the lack of significant medical advancements at that time, the Spanish flu underscored the importance of public health measures and the need for a coordinated and swift response. Relevance today. The Spanish flu serves as a reminder of how a pandemic can affect people of all ages and social strata and how the lack of information and medical resources can exacerbate disease spread. It also highlights the importance of transparent communication and global collaboration in times of public health crises. These lessons are especially relevant in the context of the COVID-19 pandemic, where accurate information and international cooperation are vital for controlling the virus's spread. The Spanish flu had a significant impact on the society of its time. Collapse of healthcare services. The magnitude of the pandemic overwhelmed healthcare systems worldwide. Hospitals and clinics were overrun, and the shortage of beds and medical personnel exacerbated the crisis. Social and economic effects. The Spanish flu disrupted daily life and the global economy. Many people lost their jobs and livelihoods, and the mobilization of troops during World War I contributed to the rapid spread of the virus. Community response. Despite a lack of a full understanding of the disease, many communities took measures to limit the spread of the Spanish flu. Quarantines were implemented, mask wearing was promoted, and social distancing was encouraged in cities and regions. Lessons for today. The Spanish flu teaches us valuable lessons that are applicable today. Preparation and rapid response. Swift responsiveness is essential in a pandemic. The Spanish flu showed how public health measures like social distancing and quarantine can help slow the spread of a disease. Importance of communication. The Spanish flu underscores the need for effective communication in times of crisis. Transparency and accurate information are essential to keep the population informed and engaged in prevention measures. Global solidarity. The Spanish flu, like the COVID-19 pandemic, demonstrated how pandemics know no borders. International cooperation and equitable distribution of resources are crucial to effectively address these threats. Final conclusion. The 1918 Spanish flu pandemic is a powerful reminder of how a contagious disease can disrupt society, the economy, and daily life worldwide. Despite the passage of time since then, the lessons learned from that pandemic remain relevant in the fight against current pandemics like COVID-19. As we continue to face public health challenges, we must remember the importance of preparedness, rapid response, effective communication, and global solidarity to protect the health and well-being of humanity. The history of the Spanish flu reminds us that, while we may face difficult times, we are also capable of overcoming them through knowledge, collaboration, and resilience. Now, we come to the COVID-19 pandemic, an ongoing event that has profoundly impacted people's lives worldwide. Despite significant differences compared to previous pandemics, the COVID-19 outbreak shares some similarities and lessons with the Black Plague and the Spanish flu. Origin and spread. COVID-19 originated in December 2019 in the city of Wuhan, Hubei Province, China. It was identified as a new type of coronavirus, known as SARS-CoV-2. Unlike previous pandemics, the spread of COVID-19 was facilitated by global interconnectedness, with air travel allowing the virus to spread rapidly worldwide. Global impact. COVID-19 has affected virtually every country in the world, causing millions of deaths and illness and millions more. The pandemic has had a significant economic impact, with business closures, job losses, and disruptions in the global supply chain. The healthcare crisis has overwhelmed healthcare systems in many places and has underscored the importance of healthcare and public health infrastructure. Responses and lessons. The COVID-19 pandemic has led to an unprecedented global response. Measures like social distancing, mask wearing, and mass vaccination have been implemented to contain the virus's spread. Scientific collaboration and the rapid production of vaccines have been outstanding examples of the capacity of science and technology to address public health challenges. Relevance today. COVID-19 is an ongoing pandemic, which means that the lessons learned are still in the process of being applied. However, some key lessons we can already extract include: importance of science. The COVID-19 pandemic has underscored the importance of scientific research and international collaboration in identifying and treating contagious diseases. Need for adaptation. Adaptability and flexibility are crucial in responding to a pandemic. Public health measures must be adjusted as more information about the virus and its spread becomes available. Clear communication. Clear and accurate communication is essential to keep the population informed and engaged in prevention measures. Misinformation can undermine public health efforts. Final conclusion. The COVID-19 pandemic is a striking reminder of how a contagious disease can have a profound and lasting impact on global society. As it continues to unfold, we must learn from the lessons of history and apply them to our current and future response. COVID-19 highlights the importance of science, adaptability, effective communication, and global collaboration in the fight against pandemics. By understanding how we have faced similar challenges in the past, we can take responsible steps to protect the health and well-being of humanity in the present and future. In conclusion, throughout this journey through the most devastating pandemics in history, we have seen how humanity has faced unimaginable challenges and emerged stronger and more resilient. From the Black Plague in the Middle Ages to the Spanish flu in the 20th century and the ongoing COVID-19 pandemic, each of these crises has left scars in history but has also taught us valuable lessons. Let's remember that we are a species capable of learning, adapting, and collaborating in times of crisis. Science and technology have been our allies in the fight against these invisible threats, and global solidarity has been crucial in confronting them. We hope this video has been informative and thought-provoking. History shows us that, while we face monumental challenges, we also have the power to overcome them together. Let's continue to take care of ourselves and learn from history to build a healthier and safer future for everyone. Thank you for joining us on this journey through the pandemics of history, and let us always remember that in times of adversity, humanity can find its best self.